So when it comes to stigma-free healthcare, I think what we've done is we've looked at what are the barriers, what makes it difficult for people to go to the doctor or to the clinic and access those services. And we've tried systematically to dismantle and to do things differently. We prioritize respect and dignity and safety for people because healthcare should be a place of absolute safety. I'm Anastacia Tomson. Pronouns are she and her. I am a medical doctor by day, and I'm very, very, very tired by night. I render primary care services as a GP, and while I do provide general healthcare, I focus a lot on caring for marginalized groups, particularly LGBTQIA+ and trans patients, and patients with complex conditions and rare diagnoses. What got me into this is that people needed me to do this, and I found myself trying to become the doctor that a younger me needed.
I'm Jabu. I'm a trans man, born in Gqeberha, in 1971, very old. I'm 54. I met Anastacia before she had practiced. All the free labor and advice and love that Anastacia extends to the trans community, I felt safe. Many of us face medical violence, gatekeeping. So I think it's really important to meet a medical person who embodies the values of, understanding what gender identity is, understanding what the journey is. So I nominated Dr. Tomson for the 2025 Champion Award because, and I don't normally nominate people, but this was important because I felt the word champion stood out for me. And champion to me means somebody who's an advocate for what they do and an advocate for the practice that they embody. And her practice around trans healthcare is such a fundamental need. I really appreciate that, and I deeply value her as a doctor and how much she's helped me be a better person. Just to be physically and emotionally better is all we want from our doctors, and she's a champion for that.
It's completely overwhelming to be nominated from a field of hundreds of doctors and clinicians and healthcare providers, and it's affirming. It says that we're doing something here that's working, but invariably it also makes me wonder, am I really worthy of this, and where can I continue to improve? It's always been important to me at the center of primary healthcare is your interaction with the person that you're treating, and if you don't recognize them for who they are, then that relationship is doomed from the start. I've had so many patients come into my office, and at some point during our consultation, they start crying and they say, I've never felt listened to by a doctor before, and it's overwhelming for them. And it is that profound that these small little things that you do, these little accommodations or the representation or whatever ways we find to communicate safety and to embody safety, this is what we do when we're inclusive, is we start to generate that culture where people can actually be relaxed and be at ease and have an open and honest conversation with the healthcare provider that they're seeing. And I can only believe that that leads to better health outcomes.